Okay, so it's a real pleasure for me representing my team, the primary care and community team of Cervera. Okay, so our team is formed by a lot of professionals in our primary care. We have a social worker, we have a dental hygienist, we have an auxiliary nursing technical, we have a physiotherapist, a psychologist, and we have an administrative and a nurse who is our leader. Okay, he's here now. So how do we develop our work? Okay, we follow the national strategy for primary and community care of the Department of Health of Catalonia. Okay, so one of the main objectives of this strategy is the creation of the community care motor group of the municipality. Okay, in this case, from Cervera. The members of this community care motor group are now, in 2018, the members were the primary care center, okay, the Cervera City Hall, Public Health Agency, and Cervera Public Health Users Association, a group of members of citizens of the village, okay, which represents the citizens, really. So at the same time, the main project of this community care motor group is the creation of health diagnosis. Okay, so we did this project in 2018. For achieve this important project for us, we did a compilation. We got quantitative information about health. We got qualitative information too, and after we got all this information, we did a presentation to the population, to the citizens of the village. Okay, I will explain all of this after. Okay, okay. Before the presentation, we analyze all this information. Okay, and after we present all this to the citizens. So here, there are some members of our team identifying health needs. Okay, this activity was useful for quality information. We need to know what people need. Okay, so in this case, we presented a map of health resources to people. Okay, it was in a street market, where we can keep contact with many people. Okay, it's easy to contact with people there. It was for qualitative information too. So we collected needs by service. We offered service for doing in paper in strategic places of the village. And we went directly to entities of the town for ask for needs, what people need. Okay, so we asked directly. For example, these entities were entities for people with disabilities, or entities for elderly. Okay, different entities. So the questions of the service were simple but very useful for us. Were first question, what makes you feel good in Cervera? What is it necessary in Cervera to improve your well-being? And what can you do to improve community well-being in Cervera? So we were looking for a proactive activity for two people. After we got all this qualitative and quantitative information, the quantitative information, we got this information from medical reports, from official statistics. Okay, so these were useful for getting the quantitative information, data information. Okay, and once we had all this information and we analyzed them, we present to the community. Okay, and it was the presentation of first health diagnosis of Cervera in 2018. After the presentation, we did a prioritization. I mean, once we know all the needs of people in Cervera, we decided to focus only in one need, okay? We're working on it next month. So this need was mental health in young people, okay? So we developed this need for working in a good way, and we decided to work in 3 axes. Okay, one axis was networking. I mean networking because all entities work in group for achieving this need for people. Okay, networking with all the entities. Family, because family is important in health for young people, and recreation. Okay, so 3 axes were working independently. So pandemic came, and after pandemic, we did a second meeting about mental health in young people, and it was in 2022. In this meeting, we decided we decided to keep 2 of 3 axes in the tasks of the city hall. Okay, so we only keep 1 axis, and it was recreation, family and networking now are tasks of the city hall. Okay. Perfect. So in 2022, the Community Care Motor Group started a new project, and it was health diagnosis too. In this case, we had a new member. It was the Catalan police. Okay, Catalan police is important for us because we know about needs of people. They can arrive to people maybe easily than us. Okay, they're in the street, and they know about needs, and this information is important for us. So for achieve this main project, we did the same steps than the other project in 2018. Okay, quantitative analysis, qualitative analysis. After we presented this information to citizens, and we did a prioritization. Okay, so we did a Google form, okay, for sending by email to people, and sending these same questions to them, okay, same questions than in the other diagnosis. So the same, we went to the entities directly and asked for needs. Okay, this is an important task in our group. We go out from the primary care center and we ask directly to people. And after we presented this health diagnosis to citizens. Okay. So the difference, the main difference of this health diagnosis comparing with the other health diagnosis in 2018 was that we thought in not focusing only in one need. So we decided to work in many areas. Okay, so we did 2 meetings. So we asked for for letting people propose solutions for these 7 areas of needs. We know. Okay, so we did a meeting for citizens. So citizens were. The citizens went to this meeting for proposed solutions for these needs. So we were looking for a proactive activity for the people too. And after we did a technicians participation meeting. So the entities directly proposed solutions for these needs. Okay. If you have any questions, you can ask. Okay. So after this presentation, we started the local health plan. So, yes?
How do you invite the citizens to participate? Because I can imagine it's not always easy to reach them. Is it something that in this region is more easily done, or do you have specific ways of making them participate?
Okay, we send emails inviting to the people to this meeting. Okay, we let posters in the street announcing this meeting. So we invite to all the village to go to that meeting, and we ask for these solutions. Okay.
What was the third one you mentioned? You mentioned like posters. You mentioned email, and the other ones.
For inviting to the people to the meeting.
Yeah.
Mainly these both ways. Yes. Sending emails and. Let posters in the street.
And also, as we do a lot of things outside of the primary care, we have a lot of contacts and a lot of groups, a lot of people walking and so on, and then you tell them, oh, you have to come to the...
Directly, yeah.
You
So,
spoke directly.
yes, we are quite
WhatsApp
active.
groups, maybe,
Yes,
yeah.
yes.
WhatsApp groups. Exactly, directly. And so after finishing this citizens and technicians participation, we started the local health plan. So we focus not in just one area, we focus in these 7 areas, okay? Because we understand health in all the policies, okay? So good government, urbanism, environment, social and community networks, mental health, healthy habits, and healthy protection.
So we have 5 more minutes.
Okay. Okay, these are the strengths of this local health plan. Multidisciplinary, citizen participation, mainly, so health in all policies. Okay. And for finishing, I'd like to mention this community project, interesting, female genital mutilation. We work on it because we detected a lot of cases of this practice in primary care center. Okay, so first of all, what is genital mutilation? This is a total or partial resection of external genitals. This is a violation of human rights, and for many African cultures, this is a preparation for adult life and marriage. Okay, and well, it's linked to thoughts of femininity and decency, so it has religious support. Okay, there are 3 types of genital resection. I don't have time to explain this, but there are 3 types. And this is the distribution of cases in African countries. Okay, in orange, type 1 and type 2 genital resection is done. And in yellow, type 3 genital resection is made normal. Short-term consequence of this practice: severe pain, bleeding, anemia, infection, urinary retention. These consequences in girls, and consequences in adults, mainly psychological. Okay, depression, fears, opposite feelings, fear to face sexual relations and birth. Okay, and feeling of guilty of the manners. Okay, for letting the practice of genital resection or to the doctors. So what did we do in primary care center? We worked in 2 ways. Okay, in one way, we established a protocol for suspicious or female genital mutilation. Okay, so in this protocol, many professionals of the primary care center worked. Okay, so we work in group for this, and after this we worked outside the primary care center with the creation of a table of female genital mutilation. In this table, many entities were participating. Okay. So, for example, if the city hall of Cervera detect new girls who are coming from African countries where genital mutilation is made, they inform to us okay, to the primary care center about this. We call to the families for make a control of these girls, okay. If we know that these girls are going to travel to their countries, okay, we ask to the families for signing a non-practice document of this genital mutilation. After the traveling, we ask for a new control in the primary care center for controlling if this practice were not done. And if the practice was done, we inform to the judge, okay, to the court, okay, because this practice is illegal in Europe. And the third way of the table of female genital mutilation was the Community Commission. In the Community Commission, we trained to teachers in the schools of the village in female genital protocol, okay, because we thought in our work together. So if in the schools they detect a case of female genital mutilation, they inform to us, okay, for making a control. Yes. And we trained two leaders of African communities for change for change the mindset about this practice, the perception, for change this perception of the practice, and they can change the perception of the members of the community to the African community. So, and this were our work of prevention, okay, from outside to inside. Thank you very much.